So Lisa, could you make the introduction for our community partner and just tell us who who we are meeting with, so that we could share this wonderful contact with our staff?
Yeah, Hannah, so I know you reached out to us and wanted to learn a little bit about Light and Anxiety, and for you guys at Renfrew, if you can share a little bit about your program coming from you and what we can learn from you today.
And just so I'm clear, your program is Renfrew.
Renfrew. It's a bit of a tongue twister. It's spelled Renfrew.
Renfrew.
Yes.
Okay. Yes. Wonderful. And so what I'm just hoping is like the elevator pitch of what clients would be the right fit for your program and what makes you guys unique?
Sure. Thanks. Yes. So our site is in Northbrook, but right now we are fully virtual, so we can work. It's really exciting because we can work with folks in the city, in the suburbs, and the entire state of Illinois, with increased accessibility through telehealth. But yes, we're remaining virtual for the time being, so that's exciting. But we treat primary diagnosis as eating disorder, and then secondary is co-occurring diagnoses. And we know that 99% of the time, no one is just walking in the door with an eating disorder. There's usually a host of other co-occurring diagnoses. And so I think something that we do that is really unique and that also allows us to collaborate is that we have a very trans-diagnostic model that really seeks to treat the whole person, so the eating disorder and everything else, because a lot of times the eating disorder might be getting a little bit better in treatment, but then the anxiety is getting worse because this has been used as a coping mechanism, or depression is getting worse, or the ways in which symptoms and trauma are showing up. And so really, really seek to have a model that we call, it's called our Unified Treatment Model for Eating Disorders, which is a mouthful. So we just say the UT, which is our evidence-based model that's also rooted in our feminist relational roots as well, that really seeks to treat the whole person and also in connection and in community with other people. So in terms of our levels of care, we have PHP, IOP, and outpatient groups. And so
you do any
those
visual therapy as well as the groups?
Yes. So a good portion of the day, especially in PHP, is the groups. But then we also have individual sessions that clients have 3 times a week with their primary therapist in PHP, and then once a week in intensive outpatient. And then they also have individual sessions with our dietitian and also with our psychiatrist at the PHP level as well. And then the rest.
Speed round of questions. Do you mind? Because I probably have of my therapist time maybe 5 more minutes of their attention. So I want to get in all the questions that I bet they would want to know. So age ranges?
12 and up.
12 and up. Wonderful. And how do you divide between the age groups? So do you have,
Yeah, that's a great question. So we actually, for the majority of programming, keep everyone together. We think it is a really powerful way of just intergenerational work of people coming together across different ages. And while they might have different life circumstances, the common underlying factors, a lot of that is similar. So in terms of groups, we have everyone together, but then we also have opportunities for breakout programming too. So we've been doing breakout programming for college students. So, folks that are in that age range and having some similar experiences, especially with, college being virtual or being really different than usual. At our residential sites, we have adolescent breakout programming, and we have what's called midlife breakout programming, which is about 30 and above. And then in our outpatient groups.
Now, though, or right now?
Is that group running now?
Or do you have residential programming right now?
Yes, we do. We have 2 residential sites, but they're on the East Coast. So one is in Southern Florida and one is in Philadelphia, Pennsylvania area, still accepting new patients with CDC protocols in place. And then they typically will then step down to our Northbrook site.
Okay, wonderful. Insurance? Yeah. What insurance do you guys?
Yeah, we take all of the big commercial insurances like Blue Cross, Aetna, United, etc. We can also work with student insurances, if people are in college and they take Northwestern student Aetna, things like that. But we always run the insurance benefits ahead of time, so people have all that information before they schedule the assessment, because we don't want anyone to be hit with bills once they're starting. So.
And does the residential accept the same insurance?
Mm-hmm.
Okay.
Yes.
And last question that I have for you, we refer often to Insight, and we're a little more familiar. So how would you contrast or think about what you guys offer and who might be a good client for you guys versus the Insight eating disorder programs?
Yeah, that's a great question. It's certainly like Insight/Eating Recovery Center in like a lot of different
Oh, eating,
places in the
okay.
city. So I certainly understand from like a geographic standpoint, a lot of times like that is what is most accessible, and like it's been around for a long time and it has awesome clinical leadership as well. I think one of the differentiators that feels important to me is that we are family run and have been for this is actually our 35th year sort of like anniversary. We were gonna have some anniversary parties, but another time when it's safe to do so. And so I think something that feels really special to me is that we remain a family-run organization even after all this time. And so decisions are being made from the family, and also really prioritizing like safety of clients and staff, especially in this time of pandemic. And so I really value that. I value that we've remained virtual because it's felt like the safest thing. And we have an awesome training department that has like in 48 hours just totally did a 180 in March in terms of how are we going virtual. We actually had a pilot program for like a year before that of virtual programming, so we're able to implement it and keep on making it better over the past, I guess, 7+ months, and continue to do so. And then I think the other piece is that being family run too, we have an opportunity to, I think, like have a lot more say in terms of the programming. And so we know like something like expressive arts therapy is really important to a lot of people. And sometimes that can get cut, you know, when there's less funding or there's less, you know, resources. And I appreciate that we continue to do that because that's really salient for a lot of clients too. So yeah, I'd say those are some of the
Great. This is so helpful, and it really,
yeah.
in referring your program to our families and for my therapist, it really brings it to life. So I really appreciate you taking the time. I had
Yeah.
one final question that went away. Oh, if for a client, we specialize in anxiety and related disorders, and we work with eating disorders light, especially when it comes to different compulsions around eating and how that might overlap with OCD. We like to know when to refer out and who to partner with. So if one of our clients is working with us, maybe still once a week, can they do your partial or your IOP program in additional to our team?
Absolutely. That's something that's really important to us too, is like making sure that there's that contact. So say they're in our IOP or PHP, we want our therapists to be speaking with you all as well in the conversation, having those kind of bridge sessions, and especially when people are stepping down too, because that can be a big jump from like 9 hours a week to then, you know, 1 or 2 hours a week. So it's definitely really important. And then when we do our outpatient groups, which a lot of time is like alumni, one of our prerequisites is that they be working with an outpatient therapist like yourself to be a part of that group.
Okay, this is so
Yeah.
great. Thank you so much. I unfortunately only have another minute or two, so Lisa, you could end the recording for now. But if anyone has any additional questions, we're lucky to have Hannah is in our database, and so for our staff, you'll get additional information to learn more.